Hi, I'm Dr. Elizabeth Melendy from Core Pediatrics in Plaistow, New Hampshire. Summertime is finally here and we're all excited to enjoy the great outdoors with our friends and family, but we also have to consider some of the problems that go along with summer, specifically the insects. For example, illnesses caused by insects, also known as insect-borne illnesses, are very rare in New Hampshire. However, they do exist. West Nile virus and Eastern equine encephalitis are two of those illnesses. Unfortunately, there's no treatment for these illnesses, but we can help prevent them by limiting our exposure to mosquitoes or by using insect repellent. Another insect-borne illness is called Lyme disease. Lyme disease is carried by a bacterium within the tick. Once someone is bitten by the tick, this bacterium can be transmitted to the person. Unfortunately, in New Hampshire, Lyme disease is very prevalent. According to the Center for Disease Control, we actually have the highest levels of Lyme disease per capita in New Hampshire, specifically in counties in our area, Rockingham, Strafford County, and Hillsborough County. Lyme disease symptoms often start within 3 to 32 days of being bitten by an infected tick. The first symptom is often a bullseye rash. Other symptoms, which begin a couple of days after the bite, include fever, chills, headaches, or body aches. If left untreated, Lyme disease can progress to a chronic infection. Some of the chronic infected areas include the central nervous system, arthritis, facial paralysis, or a heart rhythm problem. The good news is that with Lyme disease, if caught early, it can usually be treated with antibiotics, and most patients have a full recovery without any problems. Most antibiotic regimens include oral or intravenous antibiotics that last for 2 to 4 weeks. Your primary care physician can help decide what the most appropriate antibiotic course is for you or your child. Although Lyme disease is a treatable illness, we'd like to prevent it from the beginning. The best way to prevent Lyme disease is to help avoid a tick bite. Ways to avoid a tick bite include using protective clothing, like wearing long pants if you're going to be walking in the woods or in the field, using insect repellent, and doing frequent tick checks. I recommend that all my families do a daily tick check at the end of the day, especially if they've been outside, checking the scalp and the rest of the body for any potential tick bites. If you do find a tick embedded in the skin of you or your child, it's important to remove the tick as soon as possible. But please never use your bare hands to remove it, and never use things such as heat or oil to get the tick out. Really, the only safest way to remove a tick is by using tweezers or a tick remover. You take the tweezers and grasp the tick at the head, right at the base of the skin where the tick is embedded, and pull straight out. If there's any pieces of the tick left behind in the skin, please don't go digging in the bitten area. Just contact your physician for further instructions. Afterward, please clean the area with rubbing alcohol or an antiseptic soap. I hope that these preventative measures have been helpful to you and your family. If you have any more questions about Lyme disease or ticks, please feel free to contact our office at Core Pediatrics in Plaistow, 603-257-4000. You can also visit us on the website at corephysicians.org, or you can use any of our resources listed below, such as the Center for Disease Control. Thank you for your interest in learning about Lyme disease. I'm Dr. Elizabeth Melendy from Core Pediatrics in Plaistow. I hope you and your family have a happy, healthy summer.